you find a tick attached to your dog, and your first instinct might be to yank it off immediately. But that's exactly the wrong move. The wrong removal technique can leave the tick's mouthparts embedded in your dog's skin, creating a bigger problem than you started with. Here's the step by step process that will get that tick out safely and what you need to watch for in the days that follow. Use fine tipped tweezers or a tick removal tool to carefully pull the tick out without crushing it. Start by putting on disposable gloves to protect yourself from any tick-borne pathogens. Hold your tool in your dominant hand and use your other hand to part your dog's fur around the tick. Grasp the tick as close as possible to your dog's skin, not the tick's swollen body. Grabbing closer to the head gives you better leverage to remove the whole tick and decreases the chance of leaving the head behind. Pull the tick straight back from your dog's skin with a slow and steady motion. The key word is straight. Don't twist or jerk the tick away, because that can leave behind tick mouthparts embedded in your dog's skin, which can cause inflammation and infection. Never use old school methods. Don't burn, twist, or coat the tick in oils. These methods can trigger saliva release and increase infection risk. No petroleum jelly, no matches, no nail polish. These techniques actually make the tick more likely to regurgitate infected saliva into your dog's bloodstream. Once you've removed the tick, examine both the tick and the bite wound. A successful removal means you see the tick's mouth parts still attached to its body. If you notice dark specks left in your dog's skin that aren't coming out easily, contact your veterinarian rather than trying to dig them out yourself. This will only cause more irritation and inflammation. Clean the bite area with rubbing alcohol, soap, or an iodine scrub to prevent infection and wash your hands thoroughly. Put the tick in a sealed jar filled with rubbing alcohol. This kills the tick but preserves it so you can take it to your veterinarian for identification if your dog develops symptoms later. After going through those removal steps, have you ever had to deal with a tick on your pet before, or would this be your first time? Drop your answer in the comments below. Now that you've got the tick out safely, the next 48 hours are critical for monitoring your dog's health. Watch your dog closely over the next 2 to 4 weeks for any signs that a tick-borne disease may be developing. The key symptoms to look for include fever, lethargy, loss of appetite, joint swelling, and joint pain. Some diseases don't show symptoms until several months after the tick bite, but most will present warning signs within the first month. Pay special attention to sudden lameness that shifts from one leg to another. This is one of the most telltale signs of Lyme disease in dogs. You might also notice your dog becoming unusually tired, refusing food, or developing a fever above their normal temperature. Dark-colored urine, pale gums, and yellowing of the eyes or gums can signal more serious tick-borne infections that require immediate veterinary attention. Contact your veterinarian immediately if your dog develops any symptoms after tick exposure. Don't wait to see if symptoms improve on their own. Most tick-borne diseases respond well to treatment when caught early, but the window for effective intervention can be narrow. Prevention is your strongest defense against future tick encounters. Keep your dog on year-round flea and tick prevention, since ticks can stay active in temperatures above 40 degrees Fahrenheit. Check your dog thoroughly after every outdoor adventure, especially in wooded areas, tall grass, or brush. Run your hands over their entire body, paying close attention to areas where ticks commonly attach, around the ears, between the toes, under the collar, and in the armpits. The sooner you find and remove any new ticks, the lower the risk of disease transmission. Most tick-borne diseases require the tick to be attached for at least 24 to 48 hours before bacteria can spread to your dog. Subscribe for more pet emergencies and check out our flea prevention guide next.